Assalamu alaikum. Today I'm going to tell you about the major history taking points that you can use in pediatrics. The first major point is approaching the patient. You should always approach the patient from the right side. The second point to remember is introducing yourself. Then the third point is consent. Taking the consent from the child if he or she can speak or talk to you easily, or taking the consent from the mother or the guardian of the patient. Then the second point that is on the list is patient's profile that you are going to ask for. In patient's profile, you cover the following points, that is name, father's name or guardian's name, age, address, date of admission, and time of admission. After this, you ask the patient for the chief complaints or presenting complaints. In chief complaints, you have to write them in the chronological order in which the patient tells you that has the onset for the first, then the second, then the third. For example, we have a patient who has loose stools from past 4 days, fever 3 days, and history of vomiting 1 day. After this, the next heading is HOPI or history of presenting illness. In this, you are going to ask the patient about the diseases or symptoms that he or she told you first. The major points of these symptoms I'm going to discuss in my next videos, and after this you are going to ask for the past history. In past history, you ask the patient for any surgical or medically relevant admissions or any of the diseases that he or she is suffering from. And then the next heading is drug history. In drug history, you are going to ask about any of the drugs or medications that he or she is on and has been eating from several months, years, or maybe some days. So you have to ask for it. It is important to know that which medications your patient is already on. Then the next thing that you are going to ask, and the major heading, is systemic history. In systemic history, you're going to ask for the general history that includes your weight, appetite, and etc. The next thing you are going to ask in systemic history is about CVS, central cardiovascular system, then CNS, GIT, respiratory system, that if he or she has any problem in such systems relevant to the presenting complaints. Then you are going to ask for the birth history. Pediatric history is different from other histories in points that it is very lengthy first, and the second is that it contains lots of different points from other histories like birth history. In birth history, you are majorly concerned about the birth of the baby, the pregnancy of the mother, the birth time of the baby, etc. So the first subheading for the birth history is antenatal history. that is before the birth of the baby, and in this you are going to ask the mother about her pregnancy, how she got to know about her pregnancy, the diseases that she suffered from her during her pregnancy, or any medications, the supplements of folic acid, calcium, etc. that she has been eating and during her pregnancy, the ultrasounds, the number of ultrasounds, the visits to the doctor, etc. The next subheading that includes in the birth history is natal history. In natal history, you ask if the baby was born through SVD, spontaneous vaginal delivery, or C-section, and you also ask for the gestation time, if the baby is full term, on term, preterm, postterm. So the normal gestation time is obviously 9 months, so you're going to ask about that as well. Then comes postnatal history, in which you're going to ask for the health of the baby just after birth. This includes if the baby is cyanosed, jaundiced, the cry of the baby, the difficulties in breathing, whether or not present. Then you're going to ask if the baby had any birth injuries or any blood transfusions after birth, and any of the diseases that he or she suffered directly after birth. The next heading that you are going to see is the major heading, and it is about the feeding history of the baby. In feeding history, you ask about breastfeeding, the major points, that when has the breastfeeding been started, till when it is stopped, etc. Then weaning history, and in weaning you ask about when the patient or the baby had started eating, etc., and whatever his mother is giving to him to eat. The next major heading for pediatric history is immunization. In this immunization heading, we ask for the vaccinations that the baby had from the mother, and we also ask for every vaccination for polio, for hepatitis, and etc. if the baby had them or not after birth. Then the next heading is developmental history. In developmental history, you ask for the developmental milestones or gross milestones for the baby. When, for example, when he smiled, when he started neck holding, when he started sitting, crawling, standing up, and running, walking, etc. It also includes the sensory motor system and the reflexes, etc. So you are going to ask for that if the baby is, and you can judge from this heading that if the baby is developmentally delayed or not. Then the next heading is family history. In family history, under this heading, you ask for the patient's parents, the grandparents. You can ask for the chronic illnesses his parents or his grandparents are suffering from. You can also ask for the ages of the parents, and also that if any other disease like asthma, diabetes, or hypertension runs in the family, etc. or any other illness that her brothers, other siblings have. The next heading that we are going to discuss is socioeconomic history. In socioeconomic history, you ask for the patient's residence, you ask for the patient's house. Is it big? And you judge it by the number of rooms. You also ask if the house is ventilated or not. You can ask for the water for drinking and for other household uses, from where they get it, and etc. You can also ask if they have pets or not in their house, and also for their financial status. And if they are having difficulty in finances, then you can also counsel them and ask them that you can just counsel them. And this is about the pediatric history. And if you want to watch another video about other histories, I'm going to upload them soon. Thank you for watching this video, and please subscribe my channel.